Hello, my name is Jolana Cota, and I am the department chair at Palm Beach State College for the Surgical Technology program. You know what's new at Palm Beach State College? Our program is now an AS degree program. I have two of our students here. I have Stephanie Ruiz and I have Gabby Telechia.
So in surgical technology, we are responsible for setting up the sterile field and maintaining the sterile field in the operating room. We are basically the sterile police. First and main thing in mind is our patient, and we are a patient's advocate. So we have to make sure that everything, including ourselves, is completely sterile and stays sterile for the safety of our patient as well as the safety of ourselves.
After high school, you're going to start your prereqs for the program, which are Anatomy 1 and 2 with the lab and medical terminology. Those classes are really important to build your foundation for this program. Once you start the program, you have 3 semesters with lectures and clinicals. Our first semester, we do lectures and lab. Lab kind of builds up for when you start clinicals, gives you the foundations of sterility and everything you need to know. The second semester and third semester is both clinicals. We go 2 to 3 days a week, depends on which semester we're in.
Okay, well, if you want to advance your career as a surgical technologist, you could certainly become an instructor for a surgical technology program. And you can also go back for additional education and become either a first assist, a nurse, or a physician assistant. So there's many other professions that you could advance in healthcare.
In your second year in this program, the first semester, you will spend a lot of time here in our lab, in our surgical technology lab at Palm Beach State College. I will walk you through some of the things that we do here in our lab.
So in our lab, we set ourselves up for success in practice very often, learning how to open up our supplies and how to apply sterility to it as we begin to work on our patient. Here we have a few items that we work with. This is called a Mayo Stand. The Mayo Stand is going to hold the instruments that you use most often and most frequently when you're working with your surgeon and your patient. So you will pull this up to the patient. Then we have our back table. This is going to hold the rest of the items that you will be using or not be using for the surgery. You will keep it all close to you, so that way you do keep your sterile field intact and things are easy and efficient to get to and safe.
So normally, as part of our OR attire, we wear PPE, which is personal protective equipment. That includes a mask. So for the sake of this video, we had removed our masks so you could see what we had to say. Here in our lab, we practice skills and simulate surgery.
So in a real OR, this is more or less how it'll start. We have a sterile light handle because the doctors and everybody's constantly moving the lights around. Then we're going to throw off our cords. This is an electrocautery pen. This is how the surgeon cuts and coagulates during surgery.
My role as a circulator nurse is to plug any cables that are thrown off the sterile field, and anything that is needed during surgery I will go get, if it's any sutures, blades, anything else that the surgeon or the scrub tech needs.
So now we're going to throw off our suction tubing, which is used throughout the surgery, and it is used to suction additional fluids or bovie smoke from the electrocautery pen. Additional intraoperative procedures that we practice in the lab on a regular basis is passing knives. We learn safe practices because things move very fast.
Knife to the doctor.
Knife to the doctor.
Can I get a sponge, please? Knife back.
Always back in your safe zone.
Can I get a clamp, please? How about a scissors? I'll take a Metzenbaum scissors. Okay.
You always want to keep everything organized, so you always know where everything is.
To do a demonstration on how to open glove myself, I would only do this if I'm not a sterile team member. If I was a sterile team member, I would close glove myself. So here. So since this hand is already sterile, I can tuck it under the sterile portion of the next glove and then just slide.
Yeah, still good. Just to let you know, we have a lot of fun here in our lab, but it's a very serious career. And one of the most important things you can do is learn really good sterile technique, because the most important thing is our patient. The motto for our professional organization is Agere Primo, which means patient first. Whatever you do, this career is about a patient and not about necessarily making money or just doing a job.
A typical day when you come into the OR, it's never a typical day. You never know what kind of patient you're going to get. You see the patient come in, you see different emotions on their face, so you know that you need to take care of that patient. And when you're standing there and you're assisting your surgeon and the PAs and everybody else on the team, there's such a great feeling you get from knowing that protecting the sterile field is protecting this patient's life. So that's what's most important.
Some advice I'd like to give to anybody that's wanting to join the medical field or surgical technology is you have to work well with people. You have to be able to read the room, be compassionate, and have thick skin if you want to work in the medical field or be a scrub tech.
Just to let you know, at the T. Leroy Jefferson Medical Society, they offer a variety of mentorships to help support your educational endeavors. At Palm Beach State College, our tuition is affordable, and we also have financial aid and have scholarship opportunities.
So as a student, use your passion and your education to your biggest advantage. Keep up with your grades. Just keep doing what you're doing. You're doing great. It will pay off. You will get financial help. You'll get grants where you didn't even know grants existed. As long as you keep up with those grades, you will do great.